Good morning and welcome to day 2 of the 2022 North Country Leadership Summit, Optimizing Healthcare, Community Collaboration, and Workforce Resiliency. We're happy that you guys are joining us today, and hopefully you were attending some of yesterday's sessions and you'll keep continuing for the week. So we just want to give a quick thank you to our sponsors. Without their support, we wouldn't be able to make this event so successful each year. So thank you to all of them, and we hope that we keep seeing them join us every year. And then lastly, for today's session and for all of the sessions moving forward, please place all your questions and comments in the chat, and the AHI staff will ensure that your questions are answered during the Q&A portion of the session. We're asking that everyone remain muted with their video off for the presentation. And then if you have any questions on slides or recordings, all presentations will be recorded and archived on both the AHI YouTube page as well as the North Country Leadership webpage, and the link is right there. With that, I'm going to turn it over to Jen Mann, Ariella Gottlieb, and Jen Mattocks on their presentation for Plan, Recruit, Retain, TA Framework for Business Growth and Success.
Thank you, Sarah, for the introduction. We are really excited to be able to be joining with you today. My name is Jennifer Mann, and I am actually the Vice President for Bassett Healthcare Network, and my responsibility includes leading our DE&I, talent management, HR business partner, and talent acquisition functions. During my 20 years of working in HR, I've had the opportunity to work across multiple functions of HR and also specialty functions. So some of my specialty work includes working for more than one organization that focuses on recruitment process outsourcing. So I'm very honored to be joining you today with some of my colleagues. I'm going to pass it over to you, Ariella, so you can have an opportunity to introduce yourself as well.
Certainly. Thank you so much. Ariella Gottlieb, Vice President at Cielo Talent over Workforce Solutions. I have a degree in biomedical ethics from McGill University. I've been in healthcare my entire career, the last 13 years specifically in the entire clinical staffing spectrum, especially on rural health initiatives, part of the NRHA, very close to my heart. I grew up just north of the Mohawk Valley, up in Canada, so very sensitive to the area, as well as all rural across the country. I'll pass it over to Jen Mattocks.
Sounds good. Thanks, Ariella. I'm Jen Mattocks. I've spent about 14 years or so with Gartner for HR advisory, and then the Hackett Group leading best practices for both talent acquisition and talent management for leading organizations across sectors. My current role, where I've been with Cielo for the last couple of years, is SVP of Healthcare. In that role, I support our healthcare system clients in strategy to transform their talent acquisition and talent functions and to optimize to those programs to accommodate for market conditions, labor conditions, and planning and executing not only foundational strategies, but also innovative initiatives as well. So I grew up in the Midwest, in rural areas in both Wisconsin and in Minnesota. So very excited to join you here today and share a little bit about what we've learned. With that, and I'm driving here, so with that, I'm going to share a little bit about our current talent environment in partnership here with Ariella. So Ariella, I'm going to let you kick it off.
Fantastic. So as everyone can see here, the news is actually quite scary and also contradictory. As we look at today's clinical environment, I think we all realize that we are in an era of unprecedented change. More than anything, we really have to consider doing things differently. So as we look, we really don't know necessarily when the quote unquote pandemic will end as we enter into flu season and other potential influences in today's market. Some of the concerns obviously are heavily financial in today's environment, and so we must figure out a way for cost containment and patient access to care. The challenge is, more than anything, is in rural areas of how do we attract the talent, and then also how do we retain the talent? As we know that there are some cultural challenges currently with some of the providers who left during the pandemic and now need to return to their home hospitals and how that influences the environment overall in each unit. Jen, if you can switch to the next slide, that would be fantastic. So Accenture came out with the concerns of each healthcare C-suite. What's interesting is that prior to the pandemic, rarely did I have a lot of conversations with other C-suites outside of the CHRO, because most of them, quite frankly, were not necessarily interested in either contingent workforce staffing or overall workforce solutions, as they were concerned more with other areas of clinical involvement, HCAP scores, reimbursements, and other fiscal interests. However, we realize that now staffing is over 60% of an average healthcare system's budget. And so every C-suite is now at the table on how do we do things differently. I know the word burnout has been used a lot. I don't think clinicians necessarily appreciate that. What they are is overwhelmed and fatigued. And what we need to keep in mind also is that mental health is exceptionally important. Creating an environment of safety, of inclusion, and also of acceptance is exceptionally important in today's environment. So as we look through things, we don't necessarily want to just have a lens from a corporate perspective and from a C-suite perspective, but truly with our hearts on the front lines of our patients and our caregivers that are at the bedside. I'm going to wait for the next slide. So here are some more specific data points. And as we look at this, more than anything, what we want to consider is that as we look towards the clinical shortage, and this number necessarily isn't on here, but we have 11,000 people turning 65 in this country every single day. We are one of the oldest first world populations. And what happens is that a third of those are actually healthcare workers. And not only are they retiring, but they're actually re-entering the system as patients themselves, generally towards the end of their life. There are also multiple comorbidity issues and a heavy usage, which places additional strain. The other thing we're looking at post-pandemic is that what we anticipated in the industry was that the leveraging of telehealth would somehow diminish after the pandemic, that it was used as a course instead of being able to go in person, obviously very challenging during the pandemic. The use of telehealth was almost an exclusive avenue. What's happened now is that people have adopted telehealth, and so they're using it in addition to an ancillary care of their day-to-day visits. So that is why you see a lot of these numbers, 132% of increase in agency and temporary labor. As we know, that is truly a drain to the system, not only financially, but quite frankly, patient continuity of care. It's so important for our patients when they come in to be recognized, to see familiar faces, especially when dealing with chronic or acute illnesses, when we're at our most vulnerable. The trouble is also turnover right now, as we see 65% of employees believe they can find a better position elsewhere. As we see in some of the allied skill sets like medical assistants and CNAs, that number is even higher. And that truly is our concern more than anything. It's not just the clinicians, it's the overall workforce challenges. As we know, we can staff surgical centers with clinicians, but we may not be able to actually conduct some of those services if we don't have the sanitation staff, the dietitians, all of the other people who truly uplift and support all of the work of our clinicians. Then, perfect. Now, the financial war on talent is surprising. What happens is that the Northeastern region is traditionally the lowest paying area in the country, which is why we find states like New York, Delaware, Connecticut, Maine, very, very challenging to staff. In addition to, there's a tremendous housing crisis in those areas. And so even if we do the right talent acquisition and we do the right retention strategies, what we're dealing with is still a lower compensation environment and a very challenging housing environment, which really needs to be tackled overall. As we know, though, compensation is not the only lever. In today's environment, the war on talent is truly one of belonging. And so what we want is to make sure that we onboard and even pre-onboard every clinician that comes to our system as if they were perm. We want to make sure that our environment treats them with a concierge service. We want to make sure that our brand stands out. Social reputations are exceptionally important, as well as empowerment. We're finding a huge movement for self-scheduling, blocked scheduling, considerations of part-time labor, even in the physician environment. And so we must be creative. So when we talk about the financial war on talent, we also want to expand into what are we doing as organizations? Are we creating career pathing environments? Do we have diversity groups? How is our foundation involved in our work? Having medical missions, so important. We need purpose, all of us in our work today, especially post-pandemic, when we've realized our priorities have changed. Work, life, family is in a different order these days. It's life, family, and work. And so what's important is that we, as healthcare consultants, deliverers, as well as leaders, is set that example for our people and make that environment truly one of inclusion. Our overview of Cielo is that the fact that we primarily play in the recruitment process outsourcing space, which means, as it easily translates into large-scale permanent placements. The use of contingent labor is very challenging. There needs to be a continuous contract review. What we try to do is a cost containment model with a capitation, and some of our example healthcare clients are here. I believe I'm passing this back over to Jen Mann to discuss in particular the challenges that she has found at Bassett and the journey that they're currently on.
Thank you, Ariella. So in terms of Bassett, for those of you who don't know Bassett, we are located in upstate New York, and we serve our patients across 5,600 square miles in 8 different counties. So, you know, it is not something where, as we think about recruitment, we can just go, you know, knock on the door of one of our other entities and see if we can swap talent from place to place. We have to really make sure that we're thinking about our entities as really standalone organizations in how we're securing the talent. We actually have within the network, we have 3 different critical access hospitals, 2 acute care hospitals. We have 2 nursing homes. We have also assisted living. We are offering our patients an end-to-end solution. And what is, I think, unique about Bassett is that we really are embedded in our communities. So we aren't just serving our communities and going home. Our workforce actually, they are patients too. Their families are patients. And so, you know, what we're doing matters at a different level than maybe it would in a much larger geography than where Bassett is situated. The other couple things that I'll just share about Bassett is we're obviously we have clinical care that we have out across our geography. We are also known for our research as well as our Columbia Bassett Medical School. And so there's a lot of interesting draws about Bassett. And certainly one of the things I forgot to share is I'm a Midwesterner at heart as well, like the other Jen. I actually relocated during a pandemic that was supposed to end, right? We all thought it was going to be over, and relocated to come into upstate New York. And so it is a completely different talent landscape than maybe you'll find where I was from in Indianapolis, where you could just, you know, go rob Peter, over down the street at a different hospital system. That's just not the same story that you have at Bassett. So as we approach the pandemic, you know, we really approach the pandemic saying we are in an ideal opportunity, not in a difficult opportunity, but an ideal opportunity. And so we really set our strategy. And so Jen, if you'll continue forward, we began looking at a 5-year picture where we were going to be focused on becoming a best place to work and practice, really making sure that we had that diverse workforce, we empowered our caregivers. We have been focused on really best-in-class care. We are going after magnet designation and certainly the Baldrige designation. We are really ensuring that our patients that are in the community are served well, and frankly, the patients that come across the country to be served by us continue to get that best-in-class care. We're also focused on being a preferred provider of choice. Really thinking about our thought leadership. How do we come to the table, not just with our healthcare research, but other industry awards, and really modeling what rural healthcare is. And then finally, really looking at our mission-driven growth. So making sure we're focusing in the right areas and really driving our operating revenue growth so that we can be able to continue to serve our communities in the most effective way. So what does that look like from recruitment, retention, et cetera? Well, part of our 2025 journey actually included us thinking about some goals. So Jen, if you'll continue to the next slide, that actually points out our HR goals that we had. So we have been on the journey, again, since 2020, of becoming a best place to work and thinking through the different levers that we needed to think about, whether it be, what is our brand? Why do people come to Bassett? Why select us? What are the opportunities in our workforce? Looking at, as frankly, Accenture and we heard Ariella emphasize, how do we make sure our workforce is diverse? And not only diverse, but when individuals are coming into our communities, how do they feel that sense of inclusion and belonging? Because certainly, as we're bringing individuals on board, whether it be nurses or some of our residents, or even just any job across the entire network, we want to make sure that although we may not always be in diverse communities, we're helping set up our employees for success when they're interacting in their communities. So it's really an extended reach outside of our four walls, so to speak. Looking at our turnover. So what is driving that turnover? Is it what people commonly jump to of this is just compensation, or are there other drivers that we have to consider? So exploring what makes a person successful in their first year, what kind of training and onboarding experience do they need? And if I'm going to keep you long term, am I thinking about your overarching career path that can help you stay and continue to grow? Moving over to the little smiley faces, we actually spend a lot of work on our engagement. So not just taking a survey, but really looking at what those survey results tell us and have our leaders work directly with their teams to be able to say, how do we change the story to increase your level of satisfaction? And then finally, we actually focus on zero employee harm. As Ariella pointed out, this isn't just, am I slipping, tripping, and falling in the workplace, but how are we thinking about that other, the mental fatigue, the challenges that our folks are facing with the appropriate balance so that they feel good when they walk in the door, because we know that if they feel good about their work and they have the ability to focus, it's a better outcome for our patients. So as we continue our journey of talking about, the actual tactics, this just sets the stage that even though we had a difficult landscape that we were, focusing in, we didn't change what we were focused on achieving. And so with that, I believe, Ariella, are you moving into the leading practices, or is that Jen Mattocks? I apologize. Oh, we have a poll. My apologies altogether. So we want to take a second to ask you guys, if you will, in the chat box, respond. We've given you kind of the 6 challenges that Bassett was facing. What do you see as maybe your organization's biggest talent challenge? So we'll give you just a second to respond to that in the chat box. Thanks, Jen, for also including that.
Yeah, we have a lot of different areas that we can dig deeper into as far as best practices and what are other organizations doing and what is Bassett doing. But Jen, we know your journey has not been without challenges, so we look forward to hearing more about yours as well, but definitely want to lean into our participants here as well. So please do hop into the chat here and let us know what some of your challenges are. We have retention. We have getting people to follow through in the application process. That's absolutely one.
Absolutely. About 30% actually of applicants fall out. So making sure and For example, a career landing page has a very easy and quick application to just move them along. What we've learned during the pandemic, more than anything, is connecting a clinical person to a clinical person immediately is imperative. And that discussion truly should take place almost simultaneously as an initial application. The more lengthy and in-depth applications can be completed post-initial interview, and that's how we find the greatest attraction strategies.
Okay. We do have a comment in here as well. We are a small nonprofit, so we are limited salary-wise, absolutely. We know about financial constrictions, absolutely. You have a great benefit package, so really trying to sell that. The benefit package is, and I'll dig into this a little bit more in a moment, is a part of your value proposition that you offer. And in today's market, if you're at a foundational level from a salary perspective, that meaningful work and the holistic package definitely outweighs any deficit in salary. Finding candidates. It seems like we are not receiving applicants. Yes, we have seen in the last, I'd say, 36 months, the shift into having to move into a stronger recruitment marketing strategy and higher investment to fill the front of the funnel, rather than relying on word of mouth or your brand without absolutely promoting it continuously and in a broader geographic area and a broader number of channels is something that has become an absolute requirement to be able to find candidates.
I just wanted to say real quickly, I see a comment in here, competing with larger healthcare facilities. I would actually like to say we should leverage that more and more. As we've seen during the pandemic and even afterwards, some of these larger health systems do not have good brand recognition. They had a lot of negative news coverage. There's a lot of influence for that. So I truly believe now is the opportunity to strike while the iron's hot in the sense of local and bringing people back to their communities using internal referrals and making those much more lucrative. Sorry, Jen, please continue.
No, that was a great question. Meaningful work and meaningful team members and working with team members, as long as you're in a safe environment. McKinsey research just came out in August that those are the top pieces for both attraction as well as retention, and preventing individuals from wanting to leave. There was a great question in here from Brittany. Retention in a difficult training onboarding environment, given the staffing levels and increasing demand on frontline. Those who are training are overwhelmed. So I'm curious if you recommend preceptor training pay for those taking on that responsibility.
Absolutely.
Jen, Ariella, can you guys address that question for us, either of you?
So I'll start. So first of all, it is a great question, Brittany, and you're exactly right. I think that, we really landed in the pandemic with people getting very overwhelmed with having to shift how they onboarded. And I would just say, if schools were ill prepared, I think organizations were right alongside them, because, we had never had to think about how do we 100% onboard people remotely and how do we build that critical connection. So I will say that, certainly pay is one of those things that we've had, to look at to help out with that preceptor pay, so that you're actually expanding the number of people who can help support those training initiatives. I would also say, how do you take a second to step back in that onboarding programming to go see, are you saying the right things at the right time? Do you actually touch people more than one time? And how do you do that? We're in that journey ourselves at Bassett. We are actually looking at a networked new employee orientation and then touch points later on. Because, if you're like me, and you've come in, a lot gets thrown at you, more like a fire hose approach, because we aren't going to ever get them back. That's what we all say. And unfortunately, with that approach, what we find is it doesn't necessarily create, what we're wanting to for that person walking in the door and choosing us. And so how do we arm the leader so that they play some role in that onboarding process? What are the other methods that we can use to get people to come back to the table and learn more so that they're continuing that onboarding journey as a progression, more like a one-time event? So Ariella, I don't know if you have more to add, but certainly that's what we're doing here at Bassett.
I think that's wonderful. And I think, unfortunately, as a country, we really have eliminated the LPN, LVN role, which I think we need to bring back. We will never meet the nursing standards nor the patient ratios that we saw previously. Unfortunately, we're dealing with an environment in which we see some healthcare systems are up to a 1:8 or a 1:10 patient ratio. In that environment, it simply isn't sustainable, and preceptorship is vital. Having CME credits, as well as bringing back some of the certified allied professionals to help out on the floor with some of the what we would consider more entry-level responsibilities to support our nursing staff. We really need to create an environment in which everybody is participating. It is all hands on deck. Preceptorship is the key, and incentivizing others to be either formal or informal leaders is essential in today's environment as we develop one another.
That's great. And that's related to one other question that's come through, and it's around applicants to meet DOH's requirement for education and experience to work in the program and having a tough time finding those applicants.
So
Any
Jen,
response?
sorry.
No, go ahead, Jen.
One of the things that I will say that's helpful, and I know I'm jumping ahead a little bit, so I'll stay out of that lane too much, but really being able to understand what what can you do based on those requirements in terms of who else might be sitting in your house that may meet those requirements. Is there the opportunity for you to consider educational programming for them so you can expand the talent pool and actually create additional career levels? Is there ways that you can, look at, there's just, do you bring in more talent that meet those expectations? Some of them are just impossible. I know that, whether it was in Indiana or in New York, when I think about this, I think about Mattocks and the requirements that New York has on Mattocks, and there's just so much supply. And so, unfortunately, it may also be, okay, what do we need to look in terms of our service areas where we can actually meet the demand that we have? And so it's what you're hearing, I think, hopefully throughout this presentation is there is not a one size fits all or even one trick pony that you're going to be able to jump into. It is looking at multiple levers to be able to assess supply and demand, to assess services, to assess what you can do to grow the talent, or maybe even shift talent to meet some of those, expectations.
Yeah, I think one other strategy for that is around partnerships with educational institutions and universities. Like, instead of buying talent, can you grow the talent? And as we partner with healthcare organizations nationwide, the number of university relations programs and the investment from health systems into those programs has mushroomed. And if you're a smaller healthcare system and don't necessarily have that same level or ability to do that same level of partnership, just make the touch points, make the communication points with those universities and those programs, be on site as much as you can, because you may not have the same size of program, but if your voice is out there, you can go on the coattails of some of the other organizations, because we know that they're focusing on those mission critical roles. And as long as you have the partnerships and up there, you can also look to attract some of that same talent over time. Much more of a longer term strategy, but one that tends to be very fruitful. I think that's it. All right, well, let's continue on. Thank you so much for the input, and keep the comments coming along the way, and we will do our best to address them as we continue the discussion as well as at the end. So with that, is you're thinking about becoming this employer of choice, There's so many different strategies to consider and so many different levers that you can pull to really disrupt this intersecting cycle of when you're struggling with recruitment and trying to disrupt that and move to a point where you're filling positions, then lowering vacancy rates, having that authentic employee value proposition and driving retention, improving your clinical reputation, and then having that ability to attract talent. So as you're thinking about that, consider this, like every moment counts. And I know that seems like a lot of pressure, but while we cannot always be aware of the moment that is driving an individual to become a candidate, to change where they're working, those moments are fleeting, and it creates just a small window of time. And your ability to proactively synchronize your hiring needs and respond to candidates and engage them where they are at that time will dramatically increase your ability to hire that top talent. And I think about this also from a retention perspective. It hits from employees as well. So if you're there and you have the opportunity to identify that moment that is either driving an opportunity for development, and you can capture that and provide them opportunity, or if it's in a moment for engagement, or let's say lack of engagement, to identify that and offer the opportunity to provide feedback, it will often change the trajectory of that intention of that candidate or employee. So with that, it's looking at how you can set up your talent acquisition and your HR strategies to make sure that individuals receive that personalized, well-timed cadence of engagement with clear call to action. And do that across both your talent acquisition and HR teams, making sure that you're able to respond to inquiries effectively and respectfully. And it works across all channels, from that first email or text message to the interaction with the security guard at the front desk as an individual starts with your organization. That all drives the entire experience and perception. And those positive experiences drive success. And even those that aren't hired or won't be hired, but they bring in that key referral for you, or they're the silver medalist for your next hire. With that, I'm going to dig a little bit into what we're seeing is how do you fill the beginning of the funnel? What makes a difference, and why do some organizations stand out while others do not? And with that, it goes back to thinking about a consumer brand on the outside of this funnel. It's led by that. And really the purpose of that consumer brand is to serve more patients, sell more, right? And then we move in a little more narrow into that, and we look at the healthcare brand. What is that brand of your healthcare system, which then also leads into the employer brand. And there's a strong connection between each of these layers of your identity. Your employer brand is looking at who are you as an organization, what is your reputation out there in the market as an employer, and that is fed by your employee value proposition. That employee value proposition is defined by the experience of your consumer brand or your consumer promise. And that consumer promise, everything else falls out from under that and looks at how you're building off those key brand elements and bringing all of those together to engage your team members and how it's delivered. Within that, how are you bringing forth your EVP, showing that experience, and then presenting that back out to the market? And that focuses really on the candidate generation. All of these activities successfully generate through candidates. How do you get qualified, interested, and available to the top of the funnel to actually achieve the right conversations into hires and engagement? And I think of it from three sides. One, it's demand. How are you demanding for, how are you identifying careers and increasing your reach, leveraging, this is where talent data comes into play in improving your accuracy of your reach in your efforts to go after untapped audiences. So this may be where you are looking at not searching for just individuals who are currently have the experience in non-clinical settings where you're searching for it, but how do you bridge that out for someone who may have experience in parallel sectors that you could bring over to work for your organization? A huge piece is reputation, understanding and leveraging the current perceptions of your brand, and how do you bring more local advocacy to that brand presence to not only improve your reputation, but also bring in more attraction for your target markets. And then it's the experience. It's that candidate and hiring leader experience. But how can you better leverage technology, creativity, and even that data as well as human interactions to build a differentiated experience for talent? We often think that high touch is always better. That's not always the case here. Faster is better. So finding individuals in the moment in which, let's say they come home after a really long shift at another organization, they're burned out. How can you be there? And if they're searching for new roles, they do a search, how can you pop up in that search? How can you have a chat feature that will say, hey, can I help you? And then you automatically flow them into an exploratory interview when someone's at their desk in the next morning. So it's all about how can you tap into other people's interests in the time that they're interested. So with that, I think about, Ariella, as we jump into this DEI slide, I'd love your feedback and perspective on where do you see that touch point for the employee value proposition, particularly as it relates to DEI. I think of like career pages, but where else out there is that EVP really come through?
I'll jump in if it's okay. I think Ariel's got I really think that, when people are actually looking at the story of DEI, they are not just hanging out on a career page. I think that we've got sophisticated candidates with a lot of choices out there. And as part of that, they expect it on the career page, but they're actually looking for it on your organizational page. They want to see, is DEI important to how you practice? Do you have evidence of supplier diversity? Do you have evidence on social media that's telling the story of how you're having connections into the community? Do they see that you're doing events that may include, I know here you have some cultural events. Are they seeing that, you broadened your outreach, whether it is conferences or even thought leadership? So, I often, and I saw someone talk about, I just want them to get through the process. Well, I firmly believe these last couple of slides even get them to start the process, because before they're willing to even click on your career page, if they're smart candidates, they're actually taking time to go look and see who you are, what you stand for, what you believe in, and is your brand messaging authentic and accurate. And so, I think that, DEI, it's great. We should have it on the career pages. We should have those individuals talking about their story, but even more, our organization should demonstrate that when you come in, this isn't just a strategy, this is how we work. And so I apologize, Ariella. I don't know that I know I'm not getting all her comments.
No, I could not unmute myself, so I apologize. I don't know who had master control for a second, but then it allowed it. The other thing I just wanted to layer in here is when we think of diversity, it's also neurodiversity. And we need people who think differently.
Absolutely.
The other thing is that I've been doing a tremendous amount of research informally with other healthcare executives and leaders in the environment. We cannot immediately turn the dime on this. Whether we want to attract certain candidates, increase our cultural values, whatever it might be, it is like turning the Titanic, especially in rural areas. So what I've found is a lot of hospitals are now including small things to hear their people. So employee experience surveys, you wouldn't believe how much pebble ice in the cafeteria or music in the bathrooms, and that music being culturally aware in some ways. Those things are easy to implement that show an investment in we hear you. We also want to make sure you're exposed to different types of things, different menu items in the cafeteria, things along those items that show we are making changes, we feel you, but it is a long journey. And so I think we really need to truly all be neurodiverse in our approach to staffing, retention, and truly the place we work, we need to bring joy back to the workplace.
Joy is a great thing. Yes, thank you, Ariella. And with that, the one caveat to this is we look and as an organization, we work with healthcare systems to help them on this journey. We know it's a long way. And we go from a point, we measure this, and it's like a 5-point measurement scale. And I love the labels on it, because the first part is asleep, is from an employee and job seeker's perspective, there's little or no indications that your company is committed to diversity and inclusion. Then it moves to a stage of aware. Yeah, people, either job seekers or employees, they know that there's some DEI efforts, but they may not actually experience it or experience it in a consistent way. Then it moves to awake, absorb, and alive as you go up that scale. And that alive is where you see that what's out there and promoted to the market, and the images and the words that you're seeing out there is really alive in what is authentic in what an individual is experiencing throughout the hiring process and throughout their journey as an employee. So, but as we look through this, Ariella, why don't we have you off mute too? Super excited for you to talk through a little bit more on our next slide on where we're filling talent needs. Now that we have a diverse perspective to it in EVP, where are we looking for talent?
And basically, we're looking for talent everywhere. There, as we alluded to earlier, there isn't really a single source solution. We need to think about things as an interwoven solution. We also need to budget correctly for that. So, for example, as we enter flu season, it is now September. If you haven't planned for flu season in June and now it's September, we're already late to the table. So we must think about how do we have temporary staff to cover that patient census increase, in which it doesn't make sense to have full-time staff in those areas. We've seen periods of L&D needing contingency staffing from August through October. We call it baby season. And so you don't necessarily need a full-time person. You could bring in some contingency staff. One of the things that I think we need to really leverage more than anything is our retention. Because as we know, as we bring people in, whether it's contingency or perm, most of us have a sieve environment. We're bringing them in and then they're leaving on the other side. So how do we encapsulate the entire talent experience? And truly, it's treating everybody like family and hearing their voices. And so when we bring in new talent, having a preceptorship, and when we say that, it could be an informal mentorship. And so making sure that people have a sense of belonging. When we talk about referrals, for example, we've seen a tremendous increase in nursing referrals when some of the more certified or what we would consider more maintenance positions are actually incentivized higher. $1,000 to somebody who works in the cafeteria is significantly more compelling than a physician referring somebody over for $1,000. So we also should consider our audience and our availability to bring talent over. One thing that, as we talk about, we also need to consider international staffing. And so that's one of the levers that's not necessarily on here. But one of the things that we can consider, and we've seen more of, as we bring international clinicians over, they generally come with their family, and those family members can be leveraged in other aspects of our hospital systems as well. So we truly should leverage each and every angle. In terms of early talent, it's truly the social media presence that's very important. We cannot separate marketing from our engagement and our retention. If anything, we should be doubling down. People need to monitor our social media presence. We need to be on Facebook. We need to make sure that people understand who we are, what our mission stands for, and that we stand behind it.
That's great. Thank you, Ariella. And yes, that international is key. Absolutely. It is a longer term strategy. Tend not to see results from that. Start seeing them about 18 months after you make an initial investment in a program, and you see one of the greatest benefits is retention. If you're struggling with turnover at this point, these individuals are coming into the community with their families who are often looking for employment as well. It's a wonderful referral source and a great way to bring more diverse perspectives to your health systems. We are also seeing in-house traveler programs really take off. This is where you're not necessarily leveraging an outsourced traveler partner, but bringing that in, providing that same type of concept and flexibility to your employees to have those shorter term assignments that perhaps they can come every season and you're bringing them in every season. Make sure that your processes and your compliance support that, which is a great way to bring boomerangs back. Those that may have left during the pandemic may want to come back for this type of role, as well as establishing your own internal float or internal resource pool. I think about this for clinical. I think for this outside of clinical as well. And this is where you're not only offering a variety of environments to work in, perhaps you have both bedside care for end of life as well as critical care. Can you provide individuals with the opportunity to move from one to another in a specific type of environment, perhaps weeks at a time? So those are three larger type programs, but also want to include for you, and I'm not going to go over all of these for time, but you will have this in the deck. There are a number of different strategies that you can do to reduce that time to fill, because we know the time between someone expresses interest to the time that you have them walking through the door is critical, not only to the candidate, but also to your organization. So everything from having a number of live events, which we know is really tough in a rural environment, but having those virtual events that feel live as much as you can, but going into communities is very, very much an area to reduce time to fill, particularly when it's combined with on-the-spot offers, or if you have automatic ways with availability to schedule hours for interviews, as opposed to having these pause and breaks between each step of the recruitment process. With this, I'm going to look at the candidate journey. Here's where we're seeing how you improve that time to hire as well. In technology, and this is where these areas are moving incredibly fast now, and there's a lot of change. But here are a few points to look at across the candidate journey where we're seeing that marketplace, where we're seeing the EVP come through and your ability to engage in moments for that candidate. And it comes from everywhere of providing a portal that has authentic images, videos, stories that really separate your organization from others to show why you're unique and why individuals should work for you. As you do, and with this, a simple way to take a look at how do you stand out is just write down the 3 or 4 words that you see when you look at your website and when you look at your top competitors. If those words tend to be the same, we all fulfill a mission. We all are heroes. Like, if they're the same, no, you're not distinguishing yourself out there in the marketplace. Also, community building, as well as automated scoring and process automation. So if someone completes one step of the process, how do they automatically move to the next? As well as providing information to your source and screeners along the way so that they have information in hand immediately to be able to move that candidate forward. As well as candidate care, how you make sure that you are able to answer questions from multiple modalities. Can they pick up the phone? Can they answer from text? Are you reaching out to ask if they have questions along the way? And then alumni. Alumni are great. From if you know that the majority of individuals have left, you would bring back into your organization. How do you proactively campaign out to those groups and keep them engaged in your process and your organization? Comes back as well as for patients as well. Then think about before we go into the hiring manager experience, Mann, as we were prepping for this, you had spoke about a plug analogy, and I'd love for you to take just a moment to share about how that experience matters going from a candidate to an employee.
Absolutely. Thank you so much, Jen. I've used this a number of years, and it's simple because we all can just look literally at the wall and you'll remember this. So if you think about, plugging in a plug into an outlet, the way I describe to folks is as you're actually moving a candidate through the candidate journey, their plug to their company begins to loosen. When you get to the offer, that plug is not out of the outlet. It is actually still hanging on that outlet and it's connected. What you're trying to do as you move them into, getting an offer through pre-boarding activities. So how's it going with the background checks? There should be touches that are making it easier for that plug to almost be dangling out. But what's important to remember is that you may go, oh, I made it to day one. They must be now attached into their cord must have moved to a new outlet. That's actually not true. In the first 90 days, they're actually hanging out of your outlet. And they are, in the first 90 days to 6 months, I would actually say, they are still deciding if you are what they expected. And so your goal through the training process, is the onboarding process, is to seal the deal, get that cord fully plugged in. But during that time frame, they're still in contact with their former employer, and in many cases, still keeping these resumes out there, looking at other employers to see, well, maybe the grass wasn't greener, or maybe your grass was not what they thought it was going to be. And so it's really critical that we think through not only how fast we're moving, that is very important. We spoke about it a bit ago of, high touch. There are very specific times where high touch is required so that you are showing how you're different, because a lot of people are using technology and getting rid of the high touch that's critical to create the warm environment that you're bringing them into. And then we're forgetting, like, oh, now I've got you. They're forgetting to continue that journey on. So hopefully the next time you think about your new hire or your candidate experience, you'll look over at your outlet and remember what your role is in moving that cord fully plugged in to your organization.
Thank you. I appreciate that. And as we think about that, this also hits for the hiring manager experience as well. You have to use technology, or you can use technology in many different ways to enable your hiring managers to be able to create the right moments, to be able to capture and provide, to know when they want to provide that high-touch experience to the candidate, how can they move them in, and how can they better engage. And there are so many different ways to think about how, in which you can use technology along the way. It's everything from chats to interviews to scheduling to moving them forward and providing hiring managers or hiring leaders that may not be in front of laptops all day, provide them a device that they probably have handy and put the tools there for them to help you along the way as well. Jen, I'd love to take this and ask you a question around how you're using technology, and also then reflect back on your 2025 goals and how you're progressing.
Absolutely. So first of all, I'm really excited to tell you where we're at in our journey. So we have not accomplished everything on here, but what I would say to you is that for Bassett, it really was important for us to share that we were also firing on multiple cylinders to be able to change the story for ourselves. So I'll start with diversity. We actually were able to bring in a leader who is focused solely on diversity and really helping diversity be part of who we are, not just a strategy that we're trying to achieve. We've set up a network committee where we have individuals across our entire organization at all levels participating in things like what is our statement that we'll have, that is both publicly and internally facing. How do we look at our policies? How do we look at our job description so that we're actually being inclusive? And I will mention really quickly, one of our really neat achievements recently was doing what, Ariella had mentioned. We actually rolled out multiple different types of meals so that we could really have full belonging for individuals that maybe needed vegetarian or halal or kosher meals. And so making sure that that was part of what was available when both employees and patients were on site. In terms of turnover, we're changing that story by using technology. So we actually do an exit interview electronically after the person leaves rather than a face-to-face. And that may seem like, oh, is that the right high touch lost? Actually, it gives us a chance to get the really clear communication that maybe you don't want to say when you're still sitting in the chair as with the employer. So we utilize technology for that, and then provide opportunities if people want to talk specifically to an HR person after the fact and maybe come back into the fold. We use technology with Press Ganey for our surveys. We actually have action planning that our leaders are doing across the entire organization with their teams that is looked at by our executive leadership team. So we're paying attention to what do our employees want and how are we responding to that. And then in terms of our zero harm, we have certainly rolled out training, but really demonstrating that we are continuing to be focused on that physical, mental well-being that's critical for us. And what I will share with you is that we brought in partners. So there was one of the slides that talked about, what can you automate? So we have other partners that we work with that maybe they're better at some functions that Bassett is. And so we have worked with those partners to do some outsourcing. I've been honored to work with the folks that are on the telephone today. We have Cielo partnering with us in a couple different capacities to help us figure out unique ways to identify our talent. We have done the total rewards lever as well with some significant financial commitment. And the point isn't that Bassett's doing it all right, because there is no one solution. You have unique challenges in your own geographies. And so what I'm sharing is it's not one answer. It's a multi-faceted answer that's going to be required for you to move forward. And so with that, we have one more polling question in just 3 minutes. The second polling question is, what will you prioritize to address your talent challenges? This is bigger than a Jeopardy board, I think, guys. And so you've got a lot of levers that you can think of, but we want to give you a second to respond by chat. You can't do it all at one time, but where do you want to focus your attention first so that you can be able to take something tangible away and put into action based on our conversation today? So I'll give you a second to respond.
Yeah, that's great. Thanks, Jen. And as people think about this and hopefully share some of their perspectives, I'd love to ask you a question around knowing that these are a lot of different initiatives, and we know there's current financial scrutiny across the board for health systems. How do you gain support for investment required to implement some of these best practices or methods?
Yeah, I will say that, when I roll back the clock back into 2021, one of the things we knew that was very important was that the systems that we were using to secure talent and to make it an easier process were problematic. And we also knew that, we really weren't focusing in the talent acquisition process. And I know I'm not hitting retention for a second, but we really had to go tell the story. You've got to remember that whenever, maybe you live and breathe this in your world, you're talking to individuals that don't. And so we actually took some time to go help individuals understand, for us, we had 6 different systems for acquiring talent, and one was paper. They were not creating an efficient process. So we helped people understand not only what was the cost, but what would they be able to expect. And what I'm happy to share is, before we even engaged with Cielo, we had rolled out the technology of iCIMS, and we could immediately see a difference in our applicant traffic. We could see metrics that would tell us how many unique visitors, how much time were they spending in the process, what was our fall off rate, so that we could go see how to go tweak that. As you gain traction, often in one area, and that you literally have credibility, they begin to listen to some other pieces. So the second thing that I would say, Jen, is that we aren't the only experts. Make sure that you're talking to your leadership. They know what also works. So we got a lot from our leadership talking about the university school programs. They had relationships that we could leverage. So we have tapped into those and deepened our relationships, looking at programs that can bring education on site, expanding offerings for our folks. And so again, it was listening to lots of voices to go figure out a holistic solution.
That's great. Thank you. And so love the idea of a hiring leader, streamlining that process. That's great. I want to be respectful of everyone's time. It is 9 o'clock, and thank you so much to both Ariella and Jen Mann for sharing their experiences and stories. And thank you to all of you who have participated today. Thank you for your input along the way in making this an engaging session. And feel free to reach out to anyone, all three of us. Our email address is here as well. Happy to answer any additional questions you may have, and hope you have a wonderful rest of your conference. Thank you.
Thank you, guys. This was great. I will leave it open for just a minute if there are any questions. The recording will be saved on the HI YouTube page, as I mentioned before, and archived on the North Country Leadership Summit page. But thank you guys so much. This was fantastic. A lot of participation, which is always good. If anyone has any questions, please send them through. If not, have a good rest of your day. The next session is at 11 a.m. for our keynote presentation with Kim Perrone. So we hope to see you guys there.
Thank you, Sarah.
Of course. All right, everyone, have a good day.
You too, as well.